Hi, everybody. It's Michael Quirk. Welcome back. Today, I want to talk with you about unresolved attachment trauma in adults. Now, with so much talk about relationships that goes on every single day, it might sound strange to say this, but most of us seriously underplay the importance of how we're conditioned to form our attachments to our loved ones. As babies and young children, we are totally dependent on how our parents, how our caretakers take care of us. If that bonding process is not one that's nurturing or reliable or secure, it can cause problems that will affect us well into adulthood. If our childhood home is a place of neglect, abuse, if there are things like divorce, conflict, we can be traumatized. Now, I call these early environments high threat homes, meaning that the child in this environment often has the felt sense of being unsafe. Children who are raised in such environments are vulnerable. They're vulnerable to what we call attachment trauma. Since these children lack the language skills and the emotional intelligence to point out when they're young, attachment trauma can remain undiagnosed and unrecognized until they become adults. So, how do we know what to look for? Here are some common causes of attachment trauma. Until you begin creating your own independent social life, everything that you know about interacting with other people is based on how your caregivers are raising you. With unpredictable or abusive caregivers, this can result in long-term issues. To get more specific on the dynamics that I'm talking about, let's consider some of the factors that contribute to attachment trauma. One of them is not having your fundamental needs addressed and met. These might be physical needs or emotional needs, or both. Another one is living in a household in which any of the following circumstances are present: substance abuse, addiction, domestic violence, illness, disability, divorce, separation, or the death of somebody who's very close to you. And of course, abuse of any kind, whether it's physical, sexual, emotional abuse, it can be very, very, very damaging. Poor boundaries can be a cause of unresolved attachment and attachment trauma, or having parents or siblings who try to control or dominate you. Elements like these set the stage for misunderstanding, for doubt, and for fear when it comes to where and who you are and how you fit in with other people. This compromises your relational and social skills, leaving you trying to navigate a very complex world that often feels frightening and confusing to a little person. I'd like to share with you now some of the things that I've seen in my clinical work when it comes to men and women who have unresolved attachment patterns. Here are four signs of unresolved attachment trauma in adult relationships. The first one that I see is relationship problems. And this should be no surprise. It should go without saying that relationship problems are a kind of universal sign. If the attachment blueprint that's presented to you from the very start of your life is one that's dysfunctional, then of course relationships are going to be a challenge for you. So do an honest, fair assessment of your adult romantic history and see what patterns jump out at you and how far back those patterns go. Two, you might be making unhealthy choices. If you feel that you cannot trust others, you may reach a point where you'd rather avoid trying. Therefore, when you meet somebody who feels like they might be compatible with you, you can unconsciously engage in choices and actions that sabotage the very connection before it can even form. Three, here's a very common one. You might be dealing with unexplained symptoms, symptoms that don't resolve, that are uh, treatment resistant, and those might be physical or emotional symptoms. But what they have most in common is that you can't understand why they're happening, and it's hard to do something about them. Now, I would venture to say that probably 80% of my clients or more have um, symptoms that are very unexplainable: chronic migraines, IBS, somatic symptoms, uh, chronic mystery pain that has no functional diagnosis to it. Another thing to look for is number four. It's self numbing of some kind. And this is a sign that's a little bit more insidious compared to some of the earlier signs. What I mean is that you avoid possibly obtaining positive connections by kind of shutting down any openness that you have to change. Such an approach can arrive in the form of self medication, for example. So you might be struggling with substance abuse or addictions or compulsions, activities that dull and your interest in relationships and keep you from psychological intimacy with other adults. Here's a trickier symptom to identify. It's being controlling. Since you're often alone, you take to controlling all aspects of your life. So you struggle around themes of control. And this can make it appear and feel as if there's actually no room for relationships in your life. So, can we heal from attachment trauma? Here's the short answer: absolutely yes. When you have a good, wise plan and excellent follow through. Somewhere inside of you is a scared child, is a frustrated child who didn't get a fair shot at being comfortable with other people, who did not have the experience of being in a trusting, safe, mutual relationship. The good news is that you can still help that inner child. It's not your fault that your upbringing was a challenge. So don't let old fear, shame, or guilt keep you off the path of greater well being. If you keep this in mind, you might find yourself feeling more and more receptive to recovery and full blown healing. And here's more good news for you. Even in adulthood, you can change your attachment style. The research bears this out, and so do decades of clinical experience. I've seen this happen over and over and over when people do the right kind of work. This is the goal of any treatment plan for attachment trauma. So, work with an experienced trauma informed therapist because it's going to set you forward, speeding down your path of recovery. What does that look like? That looks like greater self esteem. It looks like healthier communication in your relationships. It looks like greater acceptance of other people and also greater loving, compassionate self acceptance. It also looks like learning how to set kind, fair, and firm boundaries with the important people in your life. And it looks like having relationships that enrich and support your life. So here's my final message for you. It's time to put the past behind you in a wise and healthy way. It is time to thrive. You can learn more about this topic. You can learn more about trauma, developmental trauma, complex trauma, disorganized attachment by watching my videos and by visiting my trauma treatment library. It's located at www.michaelgquirk.com. Also, I'm going to ask you if you would do me a solid here and like, subscribe, and share this video with someone that you think it might help. Thank you so much for watching.